85-year-old man who recently immigrated to the US from Spain presents to your office complaining of hoarseness and dysphagia for the past 2 months. He says his symptoms have been getting progressively worse and he expresses concern about the difficulty swallowing as he cannot eat well and has even lost 9 kilos since his last visit 3 months ago. He denies any shortness of breath, coughing of blood, and chest pain. His bowel and bladder habit are normal. Past medical history is unremarkable. He has a 60-pack-year history of smoking tobacco and drinks alcohol occasionally. It is squamous cell carcinoma. Okay, so the patient is presenting with hoarseness, dysphagia. Okay, fine, that's okay. The thing that you have to note is the fact that, he's lost weight. Okay, any questions stem, okay, from USMLE point of view, I've read USMLE point of view where they've mentioned loss of weight in a very short period of time, especially like, 3 months, 2 months, 3 months, something like that. Just, I'm not saying malignancy is always, the answer. It's not always a choice, but it's just something you keep at the back of your mind when you are approaching the answers, okay? Because it is, kind of one of the major causes of, weight loss over a very short period. Sometimes they'll also mention cachexia. They won't exactly mention cachexia. They'll talk about temporal wasting, which is one of the signs of cachexia. So, and once again, malignancy is not the only cause. Even if the patient is undernourished, okay, he's malnourished, he's an alcoholic, all of that will result in temporal wasting. But just like I mentioned, keep it at the back of your mind when you're approaching. It just makes it a little easier for your differential diagnosis. Okay, so the fact that this patient has 60-pack year history of smoking tobacco and drinks alcohol occasionally only, so you can kind of rule it out. But the fact that he has such a long history of exposure to tobacco points towards squamous cell carcinoma. Okay, so esophagus, when it comes to malignancy, just have to remember two: squamous cell adenocarcinoma. Squamous cell is your upper 2/3, adeno is your lower 1/3. Causes are very specific. Upper 2/3, because squamous cell carcinoma, think of tobacco. Okay, alcohol, smoking. Smoking is the number one cause. You can also think of alcohol. You can think of drinking very hot liquids. Okay, whereas in the case of adenocarcinoma, think of only Barrett's esophagus. Okay, there are a few other causes. Like I think even squamous cell, obesity is one of the causes, but most important, just remember smoking, remember Barrett's esophagus. Okay, so option B. Okay, that leads us to option B. So transformation leading to metaplasia in the lower esophagus, which is Barrett's esophagus. Okay, he has not mentioned anything about having GERD, because long-standing GERD or your gastroesophageal reflux disease is what leads to a metaplasia. Okay, essentially intestinal metaplasia at the GE junction. So once again, that leads us to the third option, which is malignant proliferation of glandular tissue in the esophagus is your adenocarcinoma. Option 4 is reduced lower esophageal pressure, which is GERD, like I mentioned. So option B, C, and D are essentially talking about, like the same thing. It's just like they're talking about the spectrum of the disease. So it starts with option D. So that's your GERD, leading to option B. That's your Barrett's esophagus, leading to option C. That's adenocarcinoma. Okay. So like I mentioned, the patient is not having any signs of GERD. If he is, they would definitely have mentioned, a patient having, heartburn, or the patient's having chest pain that is worse at night when he's lying down. He sometimes has, very hoarse cough. He might have slight, regurgitation. So all this just points towards GERD. Or even if they don't mention all of this, they might mention chest pain and the fact that the patient is taking any antacid or, proton pump inhibitor. Once again, just think of, GERD in that case. But since over here he has none of that, and the fact that he's been smoking for so long and presenting with dysphagia now, okay, just think of squamous cell carcinoma. The last option is chronic autoimmune gastritis. This they're talking about pernicious anemia. As you know, it will not present with anything remotely close to this. It will present only with, most likely with vitamin B12 deficiency and all the features that follow. Okay, so your megaloblastic anemia, you will have your subacute combined degeneration of spinal cord. So all of that, not related to this.
Thanks for watching. Please give a thumbs up and subscribe for more.